Welcome, everybody. So we have kind of a special webinar. Dr. Zorn is very familiar with Radar Opus and the program, and he's going to be going over a couple of cases and showing how he uses the program. If you have any questions, you can write a question or comment in the chat room, and I'll make sure to ask him. And I would encourage you guys just to listen and perhaps rewatch the video and try to practice with your own radar program. The only way you're going to learn this program is for you to actually practice and, spend a lot of time with it. It's a really powerful tool for you. So thanks for being here, Dr. Zorn.
You're welcome. You ready?
Yeah, I think we're ready.
All right. Well, thank you everybody for being here. I actually prepared, I pulled up 3 cases just in case we have extra time. What I'm going to do, so this first patient is a 34-year-old female that I've been treating for about 8 months, and I was treating her for some other things, which were resolving. But then she came to me on September 21st with a brand new set of symptoms. And when you have patients that you've seen over a period of time, there are times when they will call you up or they'll shoot you an email and they'll say, hey, I have this whole new set of symptoms, whether it's an acute or something happened traumatic in their life. Anyway, the bottom line is that we always have to present on the prescribe on the presenting symptoms, okay? So these first 2 cases are relatively short. The other one was a case I took last week for an acute because of, again, another patient that treating them chronically for something else, and all of that resolved. And then something happened last week, and they came down with a new set of symptoms. So these are shorter cases. And so what I'm going to do is I'm going to read you my notes. And what I'd like you to do is really listen to the symptoms and the information that's being given by the patient. And then I want to ask you guys, we'll grab rubrics, but we really want to focus on what's the most strange or peculiar thing here in the case. What's the characteristic symptom? What are the symptoms that we can really hang our hat on and really focus on the remedies that are in those rubrics? Okay, so let's start with the first one. Again, this was a 34-year-old female, and she presented to me in September. And so one of the things that she's dealing with was iron deficiency anemia. And she's on 200 milligrams of iron a day. And one of the problems is that she has very, very heavy menstrual flows. So my question as soon as this came up was, what symptoms do you have other than the heavy flow of your menstrual cycle, right? It's really important to understand, is there anything strange or peculiar about symptoms that come up prior to the flow? There are rubrics that specify if it's just the first day or at the beginning of the flow. And then there are rubrics that we use for during the menses. And there aren't too many for after the menses, but the main ones are before and during. So one of the things she says is when her menstrual flow starts, she develops muscle twitching in the eyes. Or the eye, she said eye socket, the left hand, and the left leg. Okay. She says I bleed very heavily. She says there's no pain with the PMS symptoms and with her menstrual symptoms. So that there really isn't a lot of pain, just heavy bleeding. And we have the twitching in the eye socket. Left hand and left leg. The other thing that she's been experiencing with this, and these heavy flows have been going on for months now, okay? And she'll talk about that in the follow-up. But the other thing that's happening is that she's developed dizziness, right? So we're gonna have to find that symptom. We need to understand when somebody says, I'm dizzy or I lose my balance, we need to know what the word is in homeopathy for that. And then we need to know, well, what makes it worse and what makes it better other than medication? So she says that her dizziness is worse from rising, and there are rubrics worse rising from the bed, rising from sitting, rising from stooping, worse stooping. Okay, so the vertigo chapter is a very, very deep chapter. So I would, if I were you, get yourself familiar with it. But again, we're looking for the peculiar characteristic things, if there are any, about the dizziness. She has spots in her vision. She gets lots of headaches, and the headaches are more right-sided. And there wasn't much else. Okay. Usually if somebody talks to me about a headache, I want to know everything. I want to, I inquire about headaches. Okay, I want sensation, if there's any peculiar sensation. I want location. I want things that make it better, things that make it worse. As a matter of fact, the next case will be an acute headache. Okay. So in this case, I asked many questions about the headache and nothing really came up other than it was worse on the right side. Okay. She mentioned to me that in a night, she lost up to 3 ounces of blood with her menstrual flow. Okay. And then she also mentioned after that blood loss of the, this was months ago, but after that blood loss, all the symptoms came on. And she also mentioned that she gets these electric-like shocks in her body since she's been dealing with this anemia. Another interesting symptom that she mentioned was that she gets these chills around 8:30 to 9 p.m. And with the chills, her teeth will chatter. The other interesting thing about her menses is that the menses has clots in it, and she said it's kind of stringy or ropey. The blood can be stringy or ropey, so you have a quality of blood to that. All right. So that's essentially all the information I got. Does anybody need me to repeat anything about that information?
What was the teeth chattering again?
So she gets chills around 8:30 to 9 p.m.
Mm-hmm.
And with these chills that she gets, her teeth will start to chatter.
Okay.
So if there aren't any questions, what I would like to know, of those things, which ones do people feel like are the most interesting? Like what's unique about this case? You have somebody, they're bleeding heavily. They have symptoms because of the heavy bleeding. The iron deficiency anemia is not unique. We would expect that. So what are some of the things that we would want to focus in on and find rubrics to express in this case?
So clotted and ropey menstrual blood,
Okay.
Muscle twitch, electric shocks, and then how she sees spots.
Okay. Mm-hmm.
Yeah, somebody else is saying electric shocks as well.
Okay.
And the dizziness worse with rising, or sorry, worse or better? I forgot.
Dizziness is worse rising.
Yeah, worse rising.
Also, dizziness worse climbing stairs.
Okay. And then the chill at night with the teeth chattering.
Correct. Mm-hmm. Yeah. So the reason that this information is it's pretty straightforward. It's because of the line of questioning that I asked. Okay. I really, in this case, I just focused on the symptoms. I looked at the headache. I looked at the dizziness. I looked at the severity of the menstrual flow and the muscle twitching. So one of the first rubrics that I looked at, which I found was most unique, is the twitching of the muscles during the flow, menstrual flow. Okay, to me, that's unique. That's actually one of the first times I've heard that. So where we're going to look for that is under generals. The generals twitching, menses. So I hope everybody understands, for those that are maybe beginners, what I'm doing. So let me slow down a little bit. Go to the binoculars. Okay, we click on that. And then all I have to do even if I don't go to the binoculars, okay, I want to go to the generals chapter. So I can just start typing in GEN, and there's generals. I press enter, and then I press twitching. And again, I've mentioned this in other presentations. We need to differentiate twitching from quivering, from jerking, from chorea. Okay, these are all different movements. And in homeopathy, if the patient describes it, you can take their word for it if you can't see it, but I would like to observe it. And in this particular case, she wasn't experiencing the twitching, so I had to take her word for it that she said she would get twitch. And you can also ask them, fasciculation is like a really quick twitch or quiver, whereas twitching is a little more, each twitch of a muscle is more defined, whereas quivering would be much quicker fasciculations. So generals, twitching, and I press enter, and then I type in menses because she says it's happening during the flow. And then we have after and during, and there's 25 remedies. So I'm not even going to look in the clip, and I'm not going to look in that rubric yet. I'm just going to grab the rubric and put it in the clipboard. Okay, and yeah, we'll write a new rubric. Okay, so we have one rubric that is, to me, very, very unique. Okay. The teeth chattering, right, during the chill. So teeth has its own chapter. It wouldn't be in the mouth chapter. It's not in the face chapter. So we just start typing in teeth, T-E-E-T-H. And then there's a word for chattering. And then there's chill. You can see right there on my screen, chill with. So during the chill, she has chattering teeth. You can grab that rubric and pull it in. Okay. The other thing is she has, this is something that I kind of thought about a little bit before I actually grabbed rubrics. She has dizziness on rising, and she has dizziness going upstairs. But why does she have dizziness? What brought the dizziness about?
Blood loss, anemia, people are saying.
Exactly. So there's a couple of rubrics, okay? So again, my synthesis is open. I'm just going to type in vertigo, enter, loss of fluids, okay? I'm going to grab that and pull that in. And then I'm going to backspace. And there's another rubric under generals. And I'm going to touch on this rubric a little bit because it is important. Generals, anemia, accompanied by vertigo. Okay? Hope that makes sense. It's not we have a reason as to why she gets dizzy when she goes to get up, when she goes, to rise from sitting or get off the bed or go upstairs, and it's the anemia. So the rubrics, generals, anemia accompanied by vertigo, and vertigo from loss of fluid are almost essentially the same thing. But I want to focus on this anemia. If you have a patient with anemia, there are rubrics like anemia with red discoloration of the face. That's considered what's called false plethora. And usually the ferrum remedies are in there, and you can see there's ferrum metallicum and graphites are in there. So anemia with a weak heart, anemia with complaints of the spleen, the liver, with constipation, with emaciation, palpitations. That's a really good one if you have a patient with anemia. It's under chest palpitations accompanied by anemia. And you've got strophanthus, which is a really big cardiac remedy. Really unique symptoms around having a weak heart. Palpitations, and arsenicum iodatum. So palpitations by anemia. Okay. So what I'm going to do is I'm going to actually combine, because they're so similar. Anytime I find a rubric, or excuse me, 2 to 3 rubrics, sometimes 4, that essentially say the same thing. They're so close, you really can't parse them out, and you want to make sure that the remedy's in there. You don't miss the remedy. Maybe you put 3 rubrics. You have 3 rubrics, and they're so similar, and one there's a remedy that's in one but not the other two, and that's the remedy you need, it's going to get pushed down in your repertorization if you don't combine all three in the instance I'm giving you. So in this case, what I'm going to do is go to the clipboard, loss of fluid, general's anemia, press. So I'm highlighting these with the command. I have a Mac. It might be a little bit different for PC.
Yeah, it's just control with the PC.
So I go to control and it opens up this clipboard, and then I want to combine. And then I want to create a new rubric and combine. Okay. The other thing about her case, nothing characteristic about the headaches. So the rubric for heavy bleeding, right? It's a big rubric and it's under female. Female, menses, there's usually copious or profuse. There's copious. 410 remedies. You're not gonna, it's just, once a rubric gets over about somewhere around in the range of 100 to 150 remedies, it becomes a lot less important. Good rubrics, unless it's so strange, rare, and peculiar, but good rubrics tend to have somewhere around, I like 15, 20, all the way up to 60 to 70 remedies in a rubric, as a general rule. Okay, it really depends from case to case. What else about her case? I think that was it. Somebody did mention or asked about the menses, stringy or ropey. So there's stringy, ropey, tenacious, and stringy. So you can double click on that and we can add that in if we want. It would really have to be tenacious and ropey. Like you see crocus is in there, crocus sativa. That's in there as a grade 3. That's a keynote for crocus, right? And then you have from the slightest motion, you've got crocus. Crocus, the type of and I'm actually going to probably cover this in hemorrhage in an upcoming webinar, excuse me. But crocus, the blood of crocus is extremely ropey, and it's usually pretty dark, okay, almost black. So if they have a nosebleed, the blood that comes out of the nose in crocus, it's worse from hot weather, so usually worse in summertime, and it's dark, almost dark red to black blood, and it's very, very stringy. So that would be a keynote for crocus. In this case, yes, it was a little bit ropey or stringy, but what I find most unique is the fact that she's having such copious blood loss, and then she's getting the symptoms because of it. She's getting the vertigo, she's getting the twitching, she's getting these electric-like shocks. So what we have is an exciting cause. It's ailments from blood loss, ailments from hemorrhage. All right. Questions?
Yeah, so we have a couple questions. So first off, we have a question where the time modality when she gets chills. Rihanna thinks that the time modality is really important.
Yes.
And then also we have Bonnie saying that we should repertorize the electric shocks. That's also important.
Okay. So here they're telling you that nighttime, for chill at night, we might have to look at evening because 22 10 p.m., right? So let's go to evening. And there's the 18th hour, which was what, 6? That's 8 o'clock. And we had a little range for her. It was 8:30 to 9.
Mm-hmm.
So we're at, what are we looking at? 20 to 21.
Yeah.
So what we could do is we could grab the 20 and the 21, put them in and combine them. Grab 19 and a half. There's 21 to 22. See, those are smaller rubrics. 21, and we'll go back to the 20. Put that one in there. And I agree that the time modality is interesting.
Mm-hmm.
in mind. The other thing that's happening here, other than just looking at the time modality, is I'm going to get feedback on that. I'm sure why. The other thing, um, can you turn your microphone on a little bit, please? Thank you. Is chill's periodic. It's a periodicity. It's happening 8:30 to 9. So we can look at that as well. Periodical. Okay. All right. So what I usually do, what I find most unique about her case, and were there other questions as well before I move on?
We have that the twitching of the extremities, the left-sided twitching, and then the right-sided head pain. They're wondering if that's important as well.
Okay. So that's that's not important because there's no association. In the totality of the case, there are right-sided headaches, but it's not like when I get my right-sided headache, I get left-sided twitching of the body. They don't correlate like that. They're not concomitant symptoms. I would need to see something like that when the patient, when the headache comes on, the right-sided headache, then I get this symptom. Okay, and we're not seeing that in this case. So I didn't pay too much attention to that.
And then also another question, are there any mind rubrics that you used?
Not in this case. No, not here. I did ask, anytime somebody has issues with PMS or menstrual issues or headaches, I do ask, which is what we should all do, even in acutes, is there any change in the person's demeanor? And one of the things you really want to pay attention to is if they tend to be very cheerful and sensitive and mild, and then around their menstrual cycle, they are irritable and abusive and rude, that carries a lot more weight than if they're always kind of rude and abusive and angry and cranky, and that just the menstrual flow or the headache or the stomach, whatever it is, it amplifies it 20%. That's not important. That's not going to really get you anywhere in homeopathy. It really has to be a change that is kind of uncharacteristic of the person's nature. Okay.
We also have a couple more questions.
Sure.
So somebody is saying the electric shocks.
Okay. So, yep. So electric shocks are under generals. Shocks, electric-like. Main remedy for that is argentum. Metallicum is one of the main ones that I always think of for electric-like shocks. So put that in there.
And then we have a question, does there have to be a fever to use the chills chapter?
Nope. There doesn't have to be. And I'll give you an example. I had a patient once that said, every time I have a bowel movement, I get a chill. So they get like a bit of a shudder. So that's chill, stool, during, aggravates. So that has nothing to do with fever. But it's a good question because in many cases, you've got your triad of stages of fever, and you've got the chill, you've got the chill phase, the heat phase, perspiration phase, or two or out of those three, sometimes just one out of those three. But in this case, you can have chill during stool. There's a whole bunch of odd, antiquated terms like a tertian chill. So it doesn't necessarily have to be related to fever, to answer the question.
And then if you go back to your repertorization, Lorraine is asking, why did you use chill periodical if you already put the time modality in another rubric?
Good question. Well, that's because chill periodical means it's happening at a periodical timing, right? It's happening. Let's go back to that. Okay. So let me just double click on it. Periodical. every afternoon, every day, every hour, every month. So you could actually focus down if there's anything unique about it. But again, when you get into rubrics like this, like every hour, and then it gives you that, same hour is a big one. Cedron is the big remedy for that. It's interesting that Bovista and Sabadilla are in there, but if it's the exact same hour, the exact same time every day, like every day at 3:15, the main remedy you should think of is Cedron, because that's one of its keynotes. But when you get into periodicity, I don't focus too much in on it because you can kind of get lost in these sub-rubrics. So what I do is I stay back and stay with the periodicity or the paroxysm of chill, where I understand that it's not sporadic. There is a timing to it. So I like to stay with chill periodical. And we combined the 8 to 9. We combine those in there. So they kind of mean the same thing. But again, these aren't the most important things in the case. The most important things in the case to me, this one is the most important. The twitching during menses. Okay, this is literally the first person I've heard in over 16 years that says, when I have my menstrual flow, I get muscle twitches everywhere. That's strange, rare, and peculiar. Okay, so I'm going to make that an elimination rubric. So I just click on it, control, and then change the qualification from normal to eliminative. I'm telling the computer, that's so unique to me that the remedy needs to be in there. Okay. And the other thing is, we've got this loss of blood, right? So when we start and we look at the remedies, we see sulfur. Sulfur almost always comes up number one. Sulfur always comes up number one, and sometimes it's overprescribed, and then some people they discount it all the time because it's like, no, this remedy always comes up, and you get kind of blind to it. So people kind of look past sulfur. We've got General's anemia accompanied by the vertigo, with the vertigo from blood loss. That's true. That's what's happening in this case. We can look at pulsatilla, then we can ask some questions about pulsatilla. In that case, I did not give pulsatilla. What's the remedy that we know of that has ailments from blood loss? It's our chief remedy, where somebody loses too much blood, they lose too much semen, they lose too much cerebral, any type of fluid, any bodily fluid. This remedy should be considered number one in the case.
China. People are saying China.
Exactly. So China, in this case, comes up number 8. And it doesn't. So what I would want to do is go to generals. So electric. I want to see if China has any electric-like shocks. So I type in. So this is the advanced search here. I type in China fissionalis, right? And then I put in electric. Enter. So now it's going to look for China in association with the word electric. And then I'm just going to look in all documents. There we have Murphy has generals, shocks, electric-like pains in the body. China's there. And then we also have Bert. Electric light is used, electric stimulation. No. So Murphy has it, but when we look in the repertory here, general shock electric light, China's not in there. Okay. So that's another, I'm giving you guys another strategy that I use, where you have to remember, even though this is synthesis and it's a combination of different repertories, the repertory is massive. I mean, I wouldn't be surprised that there's 750,000 rubrics that have been assimilated into this repertory. But even with that, it's not complete, right? We're always adding more and more information. So it's a good idea. I agree, the electric-like shocks, they are associated with the blood loss. And so if China covers that, then that's just a little more proof that is the remedy that we should give. I'd want to see more spasming in nux vomica, spasming in smooth muscles. So increased or frequent urination because the bladder's spasming, the colon is spasming, the calves are spasming, and we're not seeing that in this case. Okay, and so China was the remedy that I gave. All right. And so did everybody get that as far as, let's see, I need to move this. The search function, I put in the remedy and just put in right, if I put in shock, this might come up, but the most unique word in the term electric shock is electric. So get used to doing that. If you want to find an association of a remedy to a word, or let's say there's a term, it's got 2 or 3, maybe 4 words in it, find the most unique word in the term and then do a search between that word and the remedy. So it does cover that. All right. So this is what happened. I gave her China 1M in the office. We had a follow-up 4 weeks later, and she says, I feel stronger. There are lots of things that have improved. My vision is stronger. That's one of the other things we could have looked up. China, so let me just show you quickly. Spots. So we can look up spots and the vision chapter. I'm just going to do this quickly instead of just going to the rubrics. Colors before the eyes, black spots floating there. China's a grade 3. Also, China under the vision chapter, the vision is greatly affected by blood loss. So vision blurred after emissions. So somebody has a discharge or an emission of fluid, and it causes blurred vision. So colors before the eyes, floating, blue spots, golden chain dangling before the eyes, dim vision after coition. Okay. Exertion of the eyes, flickering during headache, focal distant unequal, loss of vision at night, loss of vision from bleeding. Okay, loss of vision after hemorrhage. I hope you guys remember in some of the other webinars I've done, sometimes the doctor uses bleeding and we see loss of vision from bleeding, and TL is Margaret Tyler, Dr. Tyler, and where is it? Herring used hemorrhage. Okay, so it's synonymous. So sometimes you have to look up different terms. Okay, so vision aggravator from sexual excesses. So that's just loss of vision. Okay, so it does cover, the remedy does cover the spots in the vision as well, which got better.
So Dr. Zorn, did she just take 1 dose of 1M?
Yes.
Okay. And then somebody is asking why 1M isn't that usually used for mental issues?
Yeah, that's the general guidelines. I felt she had, see, this is the thing, like I saw her in front of me in the office. She's a very vital person, you know, even though she was having all this blood loss, she's still like very strong mentally. I didn't feel like she had been drained, or if she came in and she was, you know, very feeble and shaking and out of breath and heart palpitations, and she really looked anemic, I probably would have gone with a lower potency, maybe like a 30C daily for a week, or, you know, maybe 200C in water. In any of these cases, what I just mentioned as suggested potencies and dosage, you're going to get an effect, right? In this case, I felt she just was strong enough that her body could take the 1M and get a good result. So let me just finish up with the follow-up. So overall dizziness is better. Heaviness of the body is better. The twitching is gone. Her iron saturation, her iron numbers improved by 15% in 1 month. She said her pulse feels better. Her heartbeat is no longer weak and choppy. That's another thing that happens in China in debilitated cases. They can get palpitations and weaker heart, and it affects the pulse as well. Just so you understand where that is. So I'm going to go to the generals chapter. So we type in generals, enter, pulse, and right here, and then you have quality of pulse. So you have full, frequent, fluttering, excited, irritable, irregular, imperceptible. So, and if we wanted to take a look, we can go to China and then type in pulse. And then repertory. 82. Oh, well, there's pulsating. So let's go to, we'll reduce that to generals chapter. There we go. Okay, pulse abnormal, pulse contracted, frequent in the morning, but slow during the day and in the evening. Frequent and intermittent, frequent and small, frequent, strong and small, imperceptible, irregular, intermittent. Okay, soft pulse, tense, thready, weak. So what this indicates is that homeopaths used to do a lot of pulse diagnosis. They used to feel the pulse and get the quality of the pulse. Okay, and chart it. So you've got Herring and Boninghausen and Kent and Boger. I'm just looking at all these little gray, Boricki, Patak, Allen. So these are all the doctors that recorded China for all of these, for pulse diagnosis. Okay, so she improved across the board. I gave her another dose to hold on to, another 1M, and we had a follow-up 6 weeks after that, and all of her symptoms from blood loss had resolved. So, and she didn't need to take the second dose of the China 1M. So it was literally 1M, 4-week follow-up, and then a 6-week follow-up. So 2.5 months, and it resolved all of her blood loss issues. Okay, questions? All right, I think we've got time for, we got time for one more. This is a short one. Okay, so again, I'm going to read the case. This was a 54-year-old male that I saw. Let me give you the date. This was an acute, 12/17. Okay, and I had him do a follow-up with me 2 days later because this is an acute case. So essentially, we talk on 12/17, and he goes, I have a really bad headache, and I have body aches. Okay. So again, okay, so you have headaches, you have body aches. This isn't part of a chronic condition. Anybody want to guess? What's the first question? See, somebody, you have a patient, established patient or new person that's coming to see you for this acute case. They tell you, this is what I'm dealing with. This is what I'm suffering with. What's the first question?
Tell me more. Is it the flu?
Mm-hmm. Yeah, tell me more is more along the lines of what I'd be looking for. Anything that gives you the facts, like we know that this is an acute, so something happened several days ago that brought on the symptoms, right? And what do we look for? We look for an exciting cause. What time of year is it? Okay, I'm in the Pacific Northwest. This time of year, the weather shifts constantly. We've got cold and dry, cold and damp, right? It might warm up a little bit, not too much, but it's usually the shift between cold, damp to cold, dry, which we did have last week. So are there other questions about or suggestions?
Yeah. Are these new symptoms, modalities, qualities, location?
Exactly.
Have you had this before?
Because if they had it before, meaning it's a part of a pattern, which you'll see some patients, every fall, they'll tell you, I get, there's a rubric, diarrhea in the autumn. I think the remedy is colchicum, and that would be under rectum, diarrhea in the autumn, aggravates.
Yep. Severity, accompanying symptoms, concomitants.
Exactly. So he didn't give me a lot of information. So I did ask him, because so I said, what happened? So we talked on the 17th. What day was that? Tuesday? I think it may have been a Tuesday.
It was a Monday.
Monday? Okay. So the Thursday, the prior Thursday, he says, it started Thursday afternoon with the change in the weather. He goes, I have this headache. And so if you guys want to write this down and then repetize it, either one. I have a headache with pressure behind the eyes. Okay. So the pressure feels like it's pushing outward. He says he also feels like there's a prying motion between his brain and his skull. His body aches are in the shoulders and the neck. And so this is like just the general information he gives me off the first few questions. And this doesn't mean that I'm not asking all these other things that everybody mentioned, okay? I am going through this very systematically. I'm just giving you the information, the irrelevant information that he gave me from all of the questions that I asked. The pressure, so I want to know the sensation. He says it's pressure. I say where. It feels like my eyes are being pushed out, body aches in shoulder and neck. And then that other weird symptom, and I have to be honest, I couldn't find it. The prying motion, like the brain and the skull, there's a prying motion between the brain and the skull. I couldn't find that. The remedy that came to mind for me was, I think it's Menyantes. It feels like a wedge is being driven into the brain. So head.
Somebody's saying, is that separation? The word separation?
Where's the rubric? Split wide open by a wedge. You know, I looked for it. I spent some time looking for it. After I finished this case up, I went into the repertory. I just couldn't find anything where if anybody finds it, let me know. But it's a feeling like, yeah, like the brain and the skull. There is a rubric like the brain feels loose, but that's not what he said. And there's a rubric like the brain is sloshing around, but that's not what he said. So the headache, again, those that said, modality is absolutely right. Sensation, concomitants, all this. So the headache is worse from motion, worse walking, worse light, worse sound. And he said by Saturday, I felt this irritability building, but he's kind of irritable in general. Okay. He's an established patient. I've seen him for a couple of years. I originally treated him for some severe musculoskeletal issues that resolved. Is that the rubric? I had to split by the wedge. Anyway, there's a remedy called, I think it's Lacnanthes, or Lacnanthes, I think it is, where they feel like there's a wedge splitting the head open. Okay, so here's the thing. Headache is worse motion, walking, light, and sound. He's given us 4 modalities that make it worse. What's the question? Are we going to put all 4 of those in?
Which one makes it the most worse?
Exactly. Which one? Of those 4 modalities, right? Because for some people, when they say, I have a headache, and these 4 things make it worse, the motion might make it worse, might make it go from like a 4 to a 5. The walking might make it go from a 4 to a 6. The light might make it go from a 4 to a 10, right? And that's the one we would use. In his case, it's the walking. Headache worse from walking, okay? And then the sensation, I asked him a little bit more about the headache because he talked about the pressure, like his eyes are being pushed outward. But then I said, is there actually any pain? And he says, yes, a severe ache in the temples, okay? Severe aching in the temples. He has dizziness with his headache. His mind feels kind of muddled and dull with the head since he's had his headache. I kind of gave it away. He goes, I'm a lot more gassy since I've had my headache. He's lost his hunger, his appetite. Some tearing in his right eye. His wife says his face looks a little more swollen. He's got a bit of a cough. I asked him about that. I didn't get much information there. And that's the case. So what in the case is strange, rare, and peculiar?
The change in weather bringing on the headache.
Absolutely. So where do we find that? We go to head, pain, weather, change of weather. Okay, I'm going to grab that, put that in the clipboard. Okay, I hope everybody understands that when there's a shift in weather, you're going to get a certain population that gets sick from it. And it does, we could take the headache worse from change of weather, and we could and go to generals, weather, change of weather aggravates, and we could combine that if we wanted to. I did not do that in this case. The remedy's in both rubrics. So yes, definitely change of weather. What else? There's about four other symptoms. And some unique ones too. There's two more that I really felt the remedy needed to be in these rubrics.
The motion making the pain worse.
So, okay, so when I asked him, was it motion, walking, light, or sound? It was walking. So I went to head, pain, walking, aggravates.
And then we have the eyes protruding.
The eyes are not protruding, they feel like they're being pushed out. There's a difference between eyes protrusion of the eyes, right? That would be like an exophthalmos. That means their eyes literally have to be protruding versus feeling like there's pressure pushing outward, pushing the eyes out.
Yeah, and that's what other people are saying, the pressure pushing the eyes out.
Okay. So let's go to the search function. Let's see, pressing eyes. So I'm putting in the word pressing and eyes, and we'll look on the head chapter, the eye chapter, search. So headache accompanied by pressing pain in the eyes. That's not exactly what he said. Forehead, pressing pain. 260 remedies. Pressing above the eyes. You see how, I hope everybody can appreciate how specific this is. Is it in the forehead? Is it right above the eyes? Extending to the neck, behind the eyes, pressing. So that's as close, I think. This is the rubric that I looked at, and I put it in there.
Somebody is also saying the right side, pressing right side.
That was from the last case. I don't think oh, I'm sorry. There was tearing of the right eye. In this case, there wasn't a sidedness to this. The other rubric, what's the other strange thing? Let's. I think a lot of what everybody's suggesting is correct, and the remedies in a lot of these rubrics that people are suggesting. But what's the other strange thing? It has nothing to do with the head. It's a concomitant with the head.
They're saying gas with headache.
Absolutely, yes. So abdomen. What's the term for gas? Flatulence during headache. Small rubric, right? Small rubric, but it's unique. He says, normally I don't have gas. That's what he told me. Because I asked him when he said that, I said, are you kind of a gassy person? He goes, no, not normally. And he goes, but since I've had this headache, okay, so that's a good concomitant because there's really You know, unless it's a gastric headache where they're nauseous or they're vomiting or something like that with the headache. But this is just, he's more gassy. So we got that. The other rubric I liked that I used was head pain in the temples. What's the synonym for aching, right? He said a severe ache in the temples. We can look for ache. That doesn't come up because we need to find another word. Sore. Oh, did somebody suggest sore?
They just did.
Okay. So sore pain in the temples. Did I put in head pain, walking? I think I put that one in there already. Yep. All right. So now, change of weather aggravates, walking, and then flatulence. Those are the ones that I made elimination rubrics. And now I have to decide between calc phos and carbo-veg. Okay. Of those two, I don't see any of the keynotes for carbo-veg, right? I don't see the hypoxia. I don't see the need for, I asked him, you know, do you feel as though you're running out of air? Do you feel like you need a fan on? Do you feel like you need a window open? And he said, no, none of that stuff. So that kind of knocks carbo-veg down for me. Another rubric I checked on to see if it was there was extremities, pain in the shoulders, aching, and calc phos was in there as well. So based on that, especially with the weather change, right? Calc phos is a big remedy for headaches. It's one of the remedies we give for fracture of the skull, for bones that are healing very slowly. But it's also a big remedy for headache. There's a rubric, head pain in school children. And there's calc phos as a grade 4. And you've got your Kunze note. Okay. So kids that get them all the time, it's one of the main remedies to consider. But NatMir is a grade 3. Phosphoric acid is a grade 4. But if you did let's just do this real quick. This will be the last thing before I take some questions. So this is another strategy I use to study remedies and remember keynotes. So I go to Calc P. There's Calcarea phosphorica. Really strong affinity for the bones in this remedy. Dr. Sujit Chatterjee had a little 7 or 8-year-old girl that had osteosarcoma, lots of fears, like a calcarea, and he gave her calc phos, and she didn't do any chemo, radiation, anything like that, and she recovered from her bone cancer from the calcarea phosphorica. He presented this case probably like 6, 7, 8 years ago. So I put the remedy in. I go to this little blue dot here. The light, or the grayed out dot, is it's inactive. When you click enter, it makes it blue. And then I get rid of the grade 2, the degree 1 and 2. And I press OK. Now it's going to find all of the rubrics in the repertories where calc phos is a grade 3 or a 4, which means it's a really strong indication, right? So we see complaining and discontent, right? Home, desires to go home, and when there, want to go out. That's discontent, right? So what does that mean? The phosphorus in calc phos indicates that it's a tubercular miasm. This discontent, needing to move around, never feeling like they're settled. These are all indications for a tubercular remedy, which would also kind of make sense in the fact that tubercular remedies can be quite sensitive to weather changes, right? Tuberculinum is very sensitive. Worse mental exertion, desire for travel, that's another tubercular indication. Headaches from mental exertion, So that's why it's the rubrics in school children. So the kids are in there, they're studying, they're using their mind, and that causes them to get headaches. Headaches along the sutures, another big one. The other remedy that's a grade 3 in there is fluoric acid, I believe. Yeah, is a grade 3. Eye pain is from a foreign body, cataracts. So this is just another way that I like to study remedies. You can kind of go through that. Hemorrhoids protrude during stool. It's one of 34 remedies. Green stools, gonorrheal discharge, chronic. Interesting. Dark menses in rheumatic patients. So anyway, I gave the remedy and we checked in 48 hours later and everything had cleared up. And I gave 30C, 3 pellets every 3 hours, up to 4 doses. And the only reason I did 30, this was more of an acute, and also he had to go out, he or his wife went out and pick the remedy up, and they can get a 30C over the counter here. They can't get anything higher than a 30. So 30C every 3 pellets every 3 hours for 4 doses. And then if he needed to, the following day, 3 pellets every 4 to 6 hours for 24 hours. And so he got in touch with me 48 hours after that, and everything was back to normal. As he said, I feel more like myself. I'm back to myself. So those are 2 quick cases, shorter cases, but they're good ones to practice repertorizing because there are unique symptoms in the case. And that's really, really important. You know, with homeopathy and with rubric selection, it's really the term that was used when I was learning all this is, you know, garbage in, garbage out. And that's not to make anybody feel bad about, you know, how their repertory skills. It's a skill that just needs to be honed and honed and honed. And I've made so many mistakes over and over and over and over again where I've put in a rubric that's too big, or I put in a rubric that doesn't exactly fit the symptom. And so what we need to do in this case, the best thing to really, really help smooth out this whole process is to go back to the case-taking process and refine that. Okay, if you haven't heard me say it before, I strongly recommend reading Eugene Nash's How to Take the Case and Find the Simillimum. It really helps you to focus and create a structure where you have this template and you just apply it. You apply it in acute cases, you apply it in chronic cases. And then after you really have that structure, then you can build on sensation method and your own personalized way of case taking to get the proper information. The patient has the information, okay? That's the other thing. All the information's there, you know, to get the right remedy. The remedy, they're in a remedy state. We can't see it with our physical eye, but if we just stay clear of jumping to a remedy too soon, stay with the patient, make sure we're thorough in our line of questioning, make sure we're thorough if we can do a physical exam, you know, look in the mouth, look at the eyes, listen to the cough, things like that. You'll get the right remedy. They're in the remedy state. We just can't see it with our eye. Okay. Any questions?
So we have one question. What is the person that you gave Calc Phos to? What is his constitutional?
Let me see. His constitutional that got rid of his really severe physical issues was nature muriaticum. But again, that's what helped him with the chronic condition that he came in with a couple of years ago, and it shifted. You know, it's nice to try to think or believe that, you know, somebody has this one remedy, and if they take it, that's the remedy for life. That's what I believed for a while, but the further along I go down this road, the more I realize that the patient's not obliged to stay in a particular remedy state. You know, life is very, very dynamic. It's kaleidoscopic. And it's our job to prescribe on what's presenting. That's, you know, the symptoms bring you to the remedy, not the theory. So Yeah. Any other questions?
Do you guys have any other questions? Christine says, do you ever go to the constitutional first?
No. No, I'll take the case. If I'm sitting down, if they're an established patient and they come in for an acute, and I sit down with them and they give me one or two symptoms, I'll type them into the computer, and if their constitutional remedy comes up maybe in the top three from the one or two symptoms, I'll consider it. But I'm not just going to give them the remedy, their constitutional remedy, just right off the bat. I want to see if it fits.
And what miasm is natriuretic in?
Malarial. It's been placed in the malarial miasm. For those of you that haven't studied, if you're just working with 3 miasms or 5 miasms, we're now up to 10. So it's a good idea to study those miasms.
So why didn't you stay in the acute miasm for this case if it was an acute presentation?
I followed the symptoms. And it's saying, so the acute miasm, if somebody's presenting with an acute, it doesn't mean they need a remedy from the acute miasm. They can present with an acute. You can give tuberculinum for fever. You can give syphilinum for fever. So you can have an acute disease presentation and need a remedy from all 10 miasms. Or any.
Yeah, sorry, I misunderstood. Okay. She meant since natriuretic was in the malarial, why didn't you stay in that malarial miasm?
Because of the uniqueness of the symptoms. So the headache came on from the change in weather. I could just, let me just get rid of this and this. And go to normal. And I'm looking at those top 10 remedies. You've got tubercular, typhoid, psoric, typhoid, psychotic, not too sure what verbascum's in. Lachesis is syphilitic, meserium, I believe, is cancer, bryonia is typhoid. You got 5 or 6 remedies in the typhoid miasm. But again, I'm following the symptoms. I'm not in acutes. I'm not necessarily trying to incorporate the thread of the miasm if it's not really there, if it's not super evident, right? So I can go to miasm and go to malarial and go here. The only remedies that are change of weather and malarial are ranunculus bulbosa, ammonium carbonicum, and spigelia. You don't, and I guess if the idea is that if their constitutional is malarial or psychotic or tubercular, that their acute remedy might need to be in that miasm. Again, what really helps me to cut through confusion with regard to miasm, because miasms can be very confusing, are the presentation of the symptoms. Okay. And we get the uniqueness and the characteristic symptoms and the prescribing symptoms and all that based on the case taking. And then everything beyond that, it kind of falls into the realm of theory. So stay with the patient, continue to hone your case taking skills and your understanding of materia medica and repertorization and miasms and all that. But it's really staying with the patient, getting a proper case, and then finding the right rubrics. And then once you do that, then you can kind of branch out into all these other very interesting and many times useful realms of homeopathy. But if this is new, if homeopathy is a bit newer to you, you haven't trained more than 5 years, and you start to dabble in all these different theories and theories of practice. Like I'm going to India next month, and I'm going to go to Rajan Sankaran is presenting. He does it one way. Dr. Sarkar case takes and present and understands homeopathy from a completely different point of view, and Farooq Master, completely different point of view. Which one's right? They're all right. How do I know that? Because the proof is in the outcomes they get. Many of their patients get well. None of them have a 100% cure rate. No physician or doctor or prescriber does. But that's part of the art of making the homeopathy your medicine, is getting really strong foundational understanding of homeopathy, and then turning it into yours, making it your medicine. And that takes time. Okay.
Thank you. One quick question, a little off topic, but since it's flu season right now,
Yes.
can a person be taking a flu preventative, like the influenzainum,
Right.
and also be treating a chronic problem with a different remedy? Can you mix those two things?
Ooh, I have a hard time mixing remedies personally. That's not part of my medicine. Um, Preventatively, I would probably go more with proper rest, tea, elderberry tea. There's other teas out there that you can take on a daily basis to help prevent flu. Vitamin C, vitamin D. I would use those more of a preventive. Um, I mean, I guess if you wanted to take influenzainum, I probably wouldn't do it more than once a week, and probably like a 30C. But I don't know if that's going to be helpful if you know. Um, so I don't have a whole lot of experience with no-sods in that manner where I'm giving something preventively. So I don't know. I don't think I can lend a whole lot of clarity to it.
Yeah. And you're getting a lot of thank yous, by the way. So
Thank you.
thank you.
I think we're going to do another one. Another one of these. I'll grab a couple more cases. I have one that's a little bit longer that if we had more time, I would have gone into it, but we don't. We ran out of time.
Okay, great. They're looking forward to the next video,
Great.
whenever that is.
Well, thank you, everybody. Have a Merry Christmas and a Happy New Year.
Yeah, thank you, everybody. If you have any questions or comments, you can just email me. I'll leave you with my email. Okay, thank you for joining. We'll see you next time.